Good afternoon, and thank you all for joining us. On today's briefing, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with Milwaukee County Office of Emergency Management, Darren Rausch, Health Officer and Director with the Greenfield Health Department, and Melissa Thiesfeld, Director of Experiential Education and Associate Professor with Concordia University School of Pharmacy and the President of the Pharmacy Society of Wisconsin. Thank you all for being here. And Mayor Barrett, we'll start with you today.
Well, thank you very much, Catherine. Well, I think we all recognize over the last 15, 16 months, life has changed pretty dramatically in the city of Milwaukee, but several things haven't changed. What we saw over the last 15 and 16 months is we saw our Milwaukee police continue to respond to calls and go out and do the policing that we all expect and want them to do. We also saw our firefighters and other first responders respond to fires and medical emergencies. We saw our sanitation workers continue to pick up garbage, continue to plow streets, continue to pick up recycling, and do the other work. Other city departments, many of them, continue to work. But we did have a significant number of people who have been working remotely. And after careful review of the science and the COVID-19 trends, we've concluded that city offices can safely reopen for business in the coming weeks. I've had in-depth conversations with both the health department and the Department of Employee Relations. And together we've decided on June 21st as the date that City Hall and other city buildings will be open to the public. Again, I want to stress that city work has never stopped since the pandemic has begun. But I think anybody who's been in this complex knows that it is a quieter place with so many people working remotely. But for the outward facing employees, that is going to change again in the next several weeks. Visitors to city buildings, no matter their vaccination status, however, will still be required to wear masks for the foreseeable future. Similarly, workers in city facilities will also wear masks when they are in public areas. Approximately 800 office workers have been working remotely or partly remotely during the public health emergency. With the reopening of public offices, many, if not most employees, will be returning to their workplaces. In specific cases, some employees will continue to work remotely or partly remotely. So we're working with our Department of Employee Relations, and Department of Employee Relations is working with the respective departments to gauge how to measure that and how to bring people back in and have others work remotely. This decision applies to all departments that are part of my administration. Departments that are led by independently elected officials will set their own reopening policies. I did speak to City Treasurer Spencer Coggs last night, and his office will be following the same pattern. It will be reopening on June 21st to the public, but its employees will continue to wear masks, and those who are entering the treasurer's office are expected to wear masks as well. I do want to say that city employees have done a remarkable job at keeping government open during the pandemic. They have shown flexibility, innovation, and dedication as they fulfilled their responsibilities. In particular, I have to give a big shout out to the health department, which I think people are much more familiar with now than they were 16 months ago. But with precautions in place, I look forward to welcoming our colleagues back to their offices. I want to now touch on some COVID gating metrics as I do each Thursday and provide an update on our own gating metrics for the week. The number of new COVID cases in the city continues to go down. That's good news. Our rate of COVID-19 cases per 100,000 remains in the substantial transmission category, and our percent positivity rate remains in the low transmission category. I love saying that, so I'll say it again. Our percent positivity rate remains in the low transmission category. As for our vaccination rate for adults in the city, we continue to see a steady upward trend. We're up to 41.9% for this week. I will note that if you look older and older and older, we see smaller and smaller racial disparities. And we see a significant number of those over 65 who have been vaccinated, people of all races. When you get down to the 20s and 30s, we see both a racial gap and we see a much smaller number overall. And so we are continuing to work, as I'll mention later, in proactively getting into the community to put shots in people's arms. But things have changed. And we all know when this started, back in December, late December, early January, we were so excited to be opening the Wisconsin Center, sort of the mega center for Milwaukee for people to come in. And at its peak, we had literally thousands of people going through there each day, and we were very, very pleased with that. But that was at the time when we were responding to those individuals who were just as anxious as could be to get the shots. That phase has now been completed. And now we are working to get our shots into the arms of people in the community at events and communities, sometimes actually at people's homes. And so the work that was being done at the Wisconsin Center has essentially been completed. As a result of that, this Friday, May 28th, will be the last day for the FEMA Mass Vaccination Center at the Wisconsin Center. I really want to take this time to thank the Milwaukee Health Department staff, FEMA, and all the Title X soldiers who staffed this vaccination site over the past few months. The vaccination clinic opened on January 12th, received federal funding and assistance beginning April 6th, and to date has administered nearly 140,000 vaccines. I'm incredibly proud of the work that the staff at the Wisconsin Center has done to vaccinate the Milwaukee community. But as a reminder, anyone can still use the Wisconsin Center for their first or second dose this week. Again, it closes this week. Those who receive their first dose will be rescheduled for their second dose at either the health department's Northwest Health Center or the Southside Health Center. In addition, this Friday, May 28th, is a second dose day for Hospitality Vaccination Day. The hospitality workers who got their first dose on May 7th should plan to return for their second dose this Friday. And as an incentive, Visit Milwaukee will award 2 lucky winners with $500 upon completion of their vaccination series. So that should be enough to get you there if you're one of those who are eligible for that. We continue this week our vaccine outward reach. And this week we administered a considerable amount of vaccines in partnership with the Brewers. I was at the ballpark last night to kick off its effort, and 97 individuals were vaccinated. This morning, we vaccinated 61 people, bringing the total to 158. Again, I consider that a success because rather than measuring this in thousands now, we're measuring it in dozens or maybe hundreds per site. And the fact that we got 158 people vaccinated there in basically 14 hours, I think is really, really good news. As a great motivator, those who received their vaccination at Helfer Field were given 2 free tickets at the ballpark for the day. I'm also pleased to share our newest partnership with Summerfest, which will be providing drive-through vaccinations from 10 a.m. to 4 p.m. on Saturday, June 5th and Sunday, June 6th at the Henry Meyer Festival parking lots. As an incentive, anyone who is vaccinated at the clinic will receive a free ticket to Summerfest 2021, valid any day of the festival. Not a bad deal. Come get a shot and get an opportunity to go to Summerfest later this year. No appointments are necessary, and residents can stay in their vehicles during the vaccination. Both Pfizer and Johnson & Johnson vaccines will be available. Those receiving the 2-dose Pfizer vaccine will be invited back on June 26th and June 27th between 10 a.m. and 4 p.m. for their second dose. Upon returning for the second dose, 1 lucky winner will be chosen to receive a special Summerfest 2021 prize package, including a U.S. Cellular Power Pass and a festival merchandise package. Again, incentives. We want you to get the shot if you haven't picked up on that already. For the remainder of the week, the following pop-up vaccination clinics will be available across the city. Today, Our Lady Queen of Peace, located at 2733 West Euclid Avenue, will be offering vaccinations to the public from 2 to 4 p.m. Tonight, the North-South Club, located at 230 East Pittsburgh Avenue, will be offering vaccinations from 4 to 8 p.m. And everyone who gets vaccinated will receive a free axe throwing or shuffleboard game. If that's your thing, if you like to throw axes or play shuffleboard, here's your chance to get your shot and have that happen as well. Tomorrow, the Mexican Consulate will continue their Friday afternoon vaccination clinic from 3 to 5 p.m. And Saturday, there will be a number of pop-up clinics going into the Memorial Day weekend from 9 a.m. to 1 p.m. at the COA Golden Center, located at 2320 West Burleigh Street. Same time, 9 a.m. to 1 p.m. at the Walker's Point Community Clinic, located at 130 West Bruce. From 10 to 2 at St. Albert Parish, located at 1923 West Beecher. Again, another Southside location. from 10 a.m. to noon at Emmanuel Presbyterian, located at 1100 North Astor Street, and from 2 to 4 at St. Roman Catholic Church, located at 1810 West Boulevard Avenue. So as you can see, we're continuing to hammer the theme that we will bring the vaccines to your neighborhood. We know that this is important. We know that there are individuals who are willing to get it, but they might not have the flexibility in their schedules, or it might not be paramount in their lives. But we know the more people who get vaccinated, the more we are going to have a healthy community. Finally, I want to share that no vaccination clinics will be held on Sunday, May 30th or Monday, May 31st due to Memorial Day holiday. So please call 286-6800 if you have any questions. And with that, I'll turn it over to Dr. Weston.
All right. Thank you, Mr. Mayor. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of 54 new cases of COVID a day and about 1 death every 2 days. And we continue to see downward trends in our burden of disease, which we're very happy to see. We're also very happy to see a welcome increase in daily vaccinations. So as of today, we're up from 1,100 1 week ago to 2,100, a near doubling over the last week in daily vaccinations being administered. First doses being administered, which is great news. So I'm hopeful that this is a result of increased vaccine confidence, as well as a shift that has occurred in the county from large-scale vaccination sites to more localized, low-barrier options, like we just heard that the Milwaukee Health Department and other health departments and health systems and community members are doing. So certainly a welcome change and a promising trend in our community. As part of that transition, we did close Kosciuszko Community Center vaccination site today after administering nearly 17,000 doses of vaccine to the community. So this was an incredible effort by our Milwaukee County Office of Emergency Management CORE team. So appropriately, CORE stands for Community Oriented Regional EMS. And it's especially commendable considering that most of this team, most of the members on that team do this work on the side, on top of their day jobs as firefighters, EMTs, and paramedics in one of the 14 fire departments in our county. So the county and this core team will continue their work on vaccinations as we transition again from these large-scale sites to more focused efforts. Now, as we head into Memorial Day weekend, many of us may have invites to gatherings, to parties, to weddings to consider. And while it can certainly be mentally hard to jump back into social events after over a year of, frankly, a large degree of isolation for many, there's also safety considerations before deciding what events you may want to skip, what to attend, and if so, how to participate safely. So what are the key questions to consider before heading over to that barbecue or going to that wedding? So first, of course, is vaccination status. If you and everyone in your family or your friend group that's attending is fully vaccinated, you can feel much more comfortable with your personal level of protection. And even more so if an event where you know everyone is vaccinated, probably a smaller scale event, but if you know everyone there is vaccinated, you can feel very comfortable attending. Now, however, if somebody in your family, such as younger kids, are not fully vaccinated or can't get vaccinated, or if it's a group, a larger group in particular, that's likely mixed between vaccinated and unvaccinated people, there certainly are other considerations to make. So then at that point, the next question would be, is it an indoor versus an outdoor event? Now, unfortunately, our weather forecast here in Milwaukee is looking a little colder this weekend. So many of those backyard picnics may end up getting pushed indoors. And we all know by this point that outdoor events are much safer, much lower risk than indoor events. Now, especially if you have people in your group who aren't fully vaccinated. So if you're in that group, you have a mix of vaccinated and unvaccinated people, just for the weather, try to be outdoors as much as possible. It'll be a little chillier, should still be fine. And finally, masking. If you're vaccinated and the event's all vaccinated people, or if you'll only be outdoors in open air, you're likely quite safe to unmask. Now, if that's not the case, if you're not fully vaccinated, if you have young children who can't be vaccinated, if the group is mixed, vaccinated and unvaccinated, and if you have to be indoors, masking is still going to be your safest option. So consider those three options: vaccination status of yourself and of the group, indoors versus outdoors, and then the need and status of masking. So I look back today at a year ago, What we were talking about on these briefings, we've been doing them for over a year now. What we were talking about on these briefings 1 year ago as we approached Memorial Day of 2020. And the message was very different. The knowledge we had about this virus at that point was very different, and the precautions were also different. But we're in a new time, a time when nearly half of our country has the protection of the vaccine, and that number is growing. It's growing nationally. It certainly, as we heard, is growing locally. We're at a time when the vaccine has driven down and continues to drive down the burden of disease in our community, and a time when we can gather and we can move back toward a more sense of normalcy. So the progress we've made is incredible, and there's still more to go. So this Memorial Day, we can celebrate that progress, we can gather safely, and we can continue to work to get our community vaccinated, get our community protected, and ultimately get our community back to normal. Thank you very much. Stay safe, and I'll hand it to Health Officer Roush.
Thank you very much, Dr. Weston. It's my pleasure to join this afternoon and to provide a little bit more data updates on top of what has been provided already. And again, you've heard some great information already about decreasing cases and increasing vaccination, and that's a good theme to see for the third consecutive week. We continue to note decreases in cases in both the city of Milwaukee and in the suburban communities. And we also see these decreases, although they're a little bit slower in decreasing among school-aged children, especially those under the age of 18. As has been mentioned previously, vaccination efforts continue countywide, including that newest most eligible group of the 12 to 15-year-olds. And the percentage of the 12 to 15-year-olds who've received their first dose vaccines in just over a couple weeks of eligibility is already approaching 15% and a little higher. So that's very, very good news. In Milwaukee overall, we're seeing 45% of the population, in the county, I should say, having received one dose, and 38% of the county residents having received both doses over the completion of the series, depending on the vaccine type. By comparison, the statewide numbers are a little bit higher at 47% and 41% respectively, but we are continuing to see some steady increases in vaccination, which is very, very positive. I'll now go forward and share the data for the week and just kind of highlight these things for you in the data reports. What you see here on the screen is the daily number of new cases in Milwaukee County. And again, Milwaukee City is in the orange line, that's the 7-day average. And the blue line reflects the suburban communities. So very sustained decreases over the last several weeks in the suburban communities and over the last couple weeks in the city of Milwaukee, but certainly heading in the right direction. When we look at the kids report and flipping to look at all children in Milwaukee County under the age of 18 here, we see that spike that we saw a little bit over a month ago in the city of Milwaukee has really come down, and we're still seeing those decreases. It might have plateaued a little bit, but certainly heading in the negative direction, which is very, very positive. So flipping back to the whole county report, as we've talked about before, deaths have been very low. I report here on the figure that we haven't seen deaths in the last couple weeks here in Milwaukee County, which is a very, very good thing. Certainly reflective of high rates of vaccination in our most vulnerable populations, and certainly something that has been a benefit to call out in the data with those increasing vaccination rates. We have tracked the transmission rate for a number of weeks, and I reflect here that right now for the county, the city, and the suburban communities, we're below 1 in all of those 3 areas, and really have been below 1 in that transmission rate since late April, which is pretty much corresponding to those decreasing rates that I showed a few slides ago. But one thing we want to know is more just this general increase right here in the most recent days. And we want to make sure that we're keeping that number below 1. So those things are very positive. The demographic situation really remains the same as it has over the last couple weeks. Certainly want to hit on the positives related to testing. Again, 14-day trends have been very, very flat in terms of percent positive, actually moving down a little bit. Testing capacity is certainly down as it corresponds so much with the disease activity, but we're still testing at a rate of nearly 12,000 tests a week. in this most recent week, and certainly there's probably more capacity and more test results that will be coming in the coming days. But again, I encourage all who need testing to certainly access testing. That's a very important piece of mitigating this disease. Testing and vaccination will help. Lastly, I want to leave you with a shot of where COVID cases have been happening. Again, as has been mentioned, we've been working on COVID for the last 15 months, and this figure shows disease rates throughout the county over the last 15 months. And the next slide shows the disease activity over the last 2 weeks. So from May 12th to May 25th. And again, this particular figure looks very similar to what we've seen in the last couple of weeks. A very pronounced area of activity in the city of Milwaukee, in the northwest side and some of the northern suburbs, as well as in areas of Greenfield and in southern Milwaukee and the southern suburbs. So it's something really to hone in on and be certainly cognizant of. The last piece of data I want to share today, or at least the last data report, is looking at the vaccination data. And again, as has been called out by both Mayor Barrett and Dr. Weston, we have seen this increase over the last week or so in our vaccination rates. And certainly a lot of that's going to be due to the 12 to 15-year-old population becoming eligible and getting vaccinated, but it's also going to be due to the pop-up events, the events of that we're vaccinating at breweries and restaurants and bars and the Milwaukee Brewers game. We're starting to see all of those things make a difference. And it might not be thousands of people, as Mayor Barrett said, but certainly every dozen, every 100 is certainly important in making sure our rates increase. And I'll just flag, certainly this slide looks at the percent of Milwaukee residents with at least 1 dose of any COVID vaccine. And certainly we see higher rates of vaccination in our older age groups by and large. You can certainly see the huge increase here in the 12 to 15-year-old age group. When we see that in fully vaccinated on this figure, we see certainly some increases still occurring, and certainly in data that is continuing to increase. And we will certainly in the next couple of weeks now start to see 12 to 15-year-old kids who have completed their vaccination series as well, which will be very positive to see that group become vaccinated. As we've called out before, certainly race and ethnicity is impacting, and there certainly is some disparities with vaccination. On this graph, we see that the white population is the most vaccinated at 50%. The Asian subpopulation is vaccinated at about 45, 46%. And below that are the Hispanic, Latinx, and the African American population. So we certainly have some work to do there. This is looking at 1 dose, and then this figure looks at both doses. So certainly some improvements there, and very happy to see all of that in our data this week. So with that, I'll end, and I just want to talk to you now about the importance that all of you in the community, all of you who are watching this briefing, what you can do to help drive immunization rates. So it's important for all of you to communicate with your family, your friends, your coworkers, your neighbors about COVID-19 vaccines. If you've received your vaccine, be a champion for others to get their vaccine. Tell the story about why you got your vaccine, why it was important for you to get that vaccination. Don't underestimate the power and the influence you have, because you can be a powerful motivator to get others to get their vaccine. Maybe you can drive them to a vaccine. You can point them to where to find information about getting vaccines. But certainly these words are no truer as I have experienced them in my own life recently. Just tell you a little story here. Last week, my younger son, my 14-year-old son, told my wife, "Hey, I'm ready for my vaccine." And when prompted why, my son stated that his baseball teammate was talking about it at practice. He was telling the other teammates, it wasn't a big deal. You know, the needle was really small. I didn't feel a thing. And that motivated my son to get his vaccine sooner rather than later. And in this case, I took him the very next day to a clinic here at the Greenfield Health Department. So in this case, it took one 14-year-old boy to convince another 14-year-old boy to get his vaccination. And certainly I was able to get him to a clinic, and there's many clinics throughout the county, and we know that, pharmacies, health departments, pop-ups throughout the community. But what struck me as most particular and most peculiar, and really focusing on how you can be a motivator and how you can empower others to get vaccinated, is that my son was quicker to listen to his friend and baseball teammate than his own father, who studied epidemiology and public health and has worked in the field for 20 years. So again, everyone out there listening, remember the importance and the power you have. This story certainly underscores and emphasizes the importance of community influencers. And I please encourage all of you to do your part in driving vaccination rates up in our community. So with that, I thank you for your time and attention, and I'll now turn the briefing over to Melissa Thiesfeld from Concordia University and also representing the Pharmacy Society of Wisconsin. Thank you very much.
Great, thank you. And thanks to all of you for having me today. As has already been mentioned, I'm here today on behalf of the Pharmacy Society of Wisconsin, which is a statewide organization representing pharmacy professionals in all practice settings, from independent pharmacies to hospital pharmacy settings to long-term care facilities and everything in between. PSW's mission is to improve the quality of medication use in Wisconsin through collaboration with healthcare teams. Pharmacists are highly trained healthcare professionals that have been on the front lines caring for patients throughout this COVID-19 pandemic. In hospital settings, pharmacists have been researching COVID treatment options and providing these medications to patients when they need to be hospitalized. In our community pharmacy settings, as has been mentioned today, pharmacists are testing patients for COVID-19. They're administering vaccines, and they're making sure patients still get all of the other medications that they need. In the early days of the pandemic, many pharmacies had to quickly shift to curbside pickup or home delivery methods to ensure that their patients could stay healthy. Pharmacy professionals have been key elements of the public health response efforts to COVID-19, both in Milwaukee and throughout Wisconsin. Whether at a local pharmacy, a nursing home, a clinic, or a mass vaccination site, pharmacy professionals have been active making sure that vaccine vials are stored and transported properly, that the vaccines are prepared correctly, and they've been administering those shots to patients. In community pharmacy settings, it's often a pharmacist and a technician working together to make sure that patients are comfortable, that they have the information they need to make their vaccine decisions, and that patients are monitored appropriately. In some of the larger vaccination settings, pharmacists, technicians, and our pharmacy students are working side by side with other healthcare professionals to make sure that the vaccination experience is both safe and efficient for patients. So as mentioned, in addition to my role with PSW, I'm also a professor at Concordia University School of Pharmacy, where I am training students to become pharmacists. The pharmacy students in Wisconsin were a vital addition to the vaccinator pool several months ago, and it's been really rewarding to see their skill development, see their confidence grow, and see the incredible dedication that they have to patients. In the last 6 months, pharmacists, pharmacy technicians, and those pharmacy students have given thousands of COVID-19 vaccines. Our pharmacy students here in Milwaukee have been visible at their universities, in their workplaces, and at public health departments providing vaccines. And we've seen pharmacy students join together to educate groups about COVID-19 and help patients find COVID resources that they're looking for. As a community, we've done a great job in getting the word out about COVID-19 vaccines, and we know that lots of people have already been vaccinated. But as we've seen today, we still have work to do. Vaccines are an important part of the equation in helping stop the pandemic. The Pharmacy Society of Wisconsin encourages everyone to get vaccinated when you're eligible. And right now, anyone age 12 and older is eligible to be vaccinated. We know that COVID-19 vaccines are safe and that they work. Some patients may experience mild side effects after getting their vaccine. I've seen some patients describe maybe some mild arm soreness, some fatigue, and maybe even after a headache after their shot. But the side effects of the vaccine don't happen to everyone, and they're generally very short-lived. They go away after just a day or two. The positive effects of getting a COVID vaccine far outweigh the severe health effects that we've seen from COVID disease. Getting vaccinated can help protect you and your loved ones by preventing severe disease, preventing hospitalization, and even preventing death. Now is a great time to get vaccinated. Pharmacies and other health settings have good supplies of the COVID vaccines that are available right now. Getting vaccinated means that you are protected sooner and you can start resuming activities that might have been put on pause because of the pandemic. It also means that our communities are protected sooner. We know that decisions about receiving COVID-19 vaccines are complex and they involve a lot of different factors. Pharmacists are an important and accessible source of information about vaccines. Those who have questions or concerns about the vaccine are encouraged to call your local pharmacy or even just stop by. Pharmacists in Milwaukee want to answer your questions, and they're equipped to do just that. If you decide to get vaccinated, pharmacists and pharmacies are accessible locations to get the vaccines. And oftentimes now you can get them on a walk-in basis. You don't even need to make an appointment ahead of time. Pharmacists in Wisconsin can vaccinate adults, they can vaccinate teenagers, they can vaccinate children. Anyone who's eligible to get their COVID vaccine right now can get one from a pharmacist. The Pharmacy Society of Wisconsin is committed to addressing healthcare disparities. Making the COVID vaccine available to everyone is an important part of that commitment. As I mentioned before, pharmacists are accessible to virtually everyone, and there are more than 100 pharmacies just in Milwaukee County alone. Pharmacists are out and about in our communities. They're providing vaccines at local churches, at libraries, community centers, schools, and sporting events, and many of those pop-up sites that were mentioned earlier today will have pharmacists at them. Some pharmacists are also available to visit individual homes to provide vaccines, so definitely reach out to a pharmacy near you and see how they can help. Lastly, I want to emphasize that pharmacists don't just provide care during a pandemic. Your pharmacist can provide lots of different vaccines. They can help you get medications at an affordable cost, and they can provide advice about health conditions. We want everyone to feel comfortable coming to the pharmacy to get the care that you need. As we tackle COVID and we adjust to our new environment, we want people to continue coming to pharmacies and using pharmacists as a health resource and as care providers. So with that, I'll close for today. Thank you again for having me, and I'll turn things back over to Catherine.
Thank you, Melissa. We really appreciate you joining us. At this time, we'll move over to our media portion of our briefing. And our first question comes from Joyce Garbasiak with WISN 12, and it's for Dr. Weston and the mayor. Do you believe the incentives various businesses have offered are helping drive the vaccination rate up? And what's the biggest reason for the doubling of the doses in the last week?
Hi, Dr. Weston, I'll follow you.
Sounds good. I'll start off on this one. So I think incentives are part of the overall landscape, but I think there's a number of reasons. I don't think, frankly, incentives are the entire reason that we've seen an increase, but I think it is an incentive that have led to some increases. I think other reasons are that people are continually having increased confidence in the vaccines. I think more and more studies are coming out and talked about in forums like this and others, talking about the safety of the vaccines, talking about the effectiveness of the vaccines. There's a continued snowballing effect of, like Health Director Roush talked about, of people talking about their vaccine experiences. That's one of the most powerful motivators, is hearing other people who you know and respect. And frankly, you may know and respect a lot more than you respect me, which is fine. Hearing them talk about their vaccine experiences. I think one of the biggest reasons we're seeing an increase is because of this shift in strategy. We understand that people are not coming in flocks to our mass vaccination sites. And so we're going out to grocery stores, to community centers, to churches, to parks, to where people are, and offering vaccines and taking down any barriers that are possible. So I think in short, yes, the incentives are helpful. I think the incentives are good, but I think the incentives are in a broader landscape of the reason why we're seeing increases in vaccinations.
And I certainly would concur. And I think the most important thing is that more and more people now recognize how safe the vaccination is. If that were not the case, we would be in a world of hurt. But I would say each time a new study comes out, each time we see additional numbers about how safe this is, I think that for those individuals who took the wait and see attitude, more and more they're getting convinced. So I think that's a major part of it. But we also know that there are a gazillion reasons why people do things. And for some people, a glass of beer is enough. For somebody else, a brewer's ticket or a Summerfest ticket. For somebody else, it's going to be something else. And so you've really got to find people where they are in their lives. And I think, as you've heard from Dr. Weston and from Darren Rush, you also have to have credible messengers, because the fact of the matter is, oftentimes a 14-year-old is a far more credible messenger than someone who's elected official or has a medical degree. It's, how was it? And it was fine. Bingo, you're on your way. So what you're seeing here is you're seeing government in action, in the sense that we are trying to be as nimble as possible and trying to reach people where they are. And the reason we're doing that is that we know that there are incredibly positive health effects, economic effects, cultural effects, the more people get vaccinated. And so it's worth the effort. We're going to try whatever works, and we're going to keep changing until we get it right.
Our next question is for Mayor Barrett, and it comes from Madeline Anderson with Fox 6. She's wondering, the city is dropping its mask ordinance on June 1st. Why are masks still going to be required for visitors, regardless of vaccination status, inside city buildings for the foreseeable future? And what is the policy going to be for city employees when at their office?
So the decision to drop the mask mandate for the city, in essence, was based on two things. One, of course, was the CDC guidance. That was a powerful, powerful statement that said that if you're fully vaccinated, you don't need to wear the mask. What did that do? That created maybe an intended, maybe an unintended ripple effect for us as the enforcer of the ordinance. It made it virtually impossible for us to enforce it. What I mean by that is, how do you go to establishment and not know who's vaccinated and who isn't, and knowing that people who are not vaccinated don't need to be wearing the mask. At the same time, we are an employer. And so what we have said all along is that for those organizations, those businesses, those entities that make the decision that they are going to continue to have a mask policy, we're going to support that. It so happens that the city of Milwaukee government is one of those entities. We feel, and I'm talking about the outward facing departments, and I'll use the Treasurer's Department as an example, because I had a good conversation with Treasurer Coggs last night about this. His employees are going to be wearing the masks. They don't know, the individuals coming in, whether they have gotten the vaccinations or not. And so they just want to be careful. And I support that. So to me, it's very, very consistent. The challenge in enforcement was, how do you enforce something if some people are rightfully not wearing it and others are not rightfully wearing it? In terms of the building here and city government, you can make differentiations. That doesn't mean people are going to get tickets, but that's going to be what our policy is going to be, at least for the foreseeable future. And my hope is it ends sooner rather than later.
Our next question is from Drake Bentley with the Milwaukee Journal-Sentinel. It is for anyone on this call. Perhaps Dr. Weston, you might be able to jump in to start tackling it first, and we go from there. The question is, in the most recent 1,000 statewide deaths, the Black population is dying a higher rate than its population percentage. On top of that, the Black vaccination rate is around 25% in the city. Do you believe it is the responsibility of health officials and elected officials to increase the Black vaccination rate? And if so, how?
Sure. So we have seen inequities and disparities, well, long before COVID, but certainly amplified and exemplified during the pandemic. We saw it in the very beginning with the first cases, with the first deaths, and we continue to see it probably most pronounced in the vaccination rates among communities of color. Now, I think it's the responsibility of all the health departments, the health systems, the governments, and the public to address this in a variety of different ways. Milwaukee County a long time ago declared racism as a public health crisis, and that's something we've continued to embrace throughout the pandemic. That's why we created the EVE model, to better understand how vulnerability plays into vaccination rates and how to better target those communities. And certainly our health departments have worked side by side with those same goals and those same ideals in mind. So I think to answer your question, it's all of our responsibilities to continue to get everybody in our community, but especially the more vulnerable members of our community, which often, unfortunately, oversects with populations of color, to drive up our vaccination rates to ultimately make those individuals, but also our community safer.
And I would, again, concur with the doctor. It is all of our responsibility. And what I've said and what my office said, appearing before the Common Council Committee just yesterday, was I think the place where we have 100% commonality is that we all agree that we have to get the vaccination rates higher. And so this is a call, a clarion call to everybody in government, in healthcare, in the community, to get those vaccination rates higher. And that's exactly why we're taking it directly into the community, because we think that that may be the most effective way. If it's not, we're going to try something else. But we are certainly committed to increasing the vaccination rate for all people of color, for everyone in this community, because we know how important and how effective it is.
The next question is for Mayor Barrett, and it comes from Ben Jordan with TMJ4. He says, the Milwaukee Health Department says just 309 people have been vaccinated at the Milwaukee Public School clinics since they opened nearly 2 weeks ago. What is your reaction to that figure, and how do city and county leaders hope to convince more people to get vaccinated as restrictions go away next week?
I'm not discouraged by that. In fact, I want to see us expand that program and do more vaccinations in the schools. One of the earlier questions was, why have we seen an increase in vaccinations this last week? And the answer is pretty straightforward. It's because the 12 to 15-year-olds were eligible. So we've got a large pool that has a relatively low number right now. I think it was 15% in the numbers that Darren Roush was showing. So we know that there's a lot of growth there, that we can see a lot of growth there. And we do want to partner with the schools. We know, of course, the school year is ending relatively soon. So it's going to be logistically somewhat of a challenge. But it goes with my theory that we are going to partner with everyone and anyone we can that can bring us individuals to have the vaccination. And I'll say what I said earlier. We are not measuring the victories by 1,000 per day. It's dozens or tens where we're saying, okay, we've made this progress. So we will have literally hundreds of pop-up events led by Dr. Nick Tomorrow, who is going into the community with community partners to try to get more and more people vaccinated. That's what we're going to continue to do.
Ben has a follow-up question. He's wondering, Mayor Barrett, if you know if the city or county is considering offering additional incentives to get more people vaccinated.
We certainly have had those conversations internally. We still feel that there's a pool out there of people who are not getting it because there just isn't convenience or they haven't thought about it. I was out on the street last week and I was talking to a couple of people. And even though we've had these briefings for 15 months, 2 or 3 or 4 days a week, when I talk to them, they're not watching these briefings, and that's not a negative statement. This was not an issue in their life. And so it's, how do you reach people where they are? And so we're going to continue to try to be as creative possible in reaching people where they are in their lives at that moment.
Allison Durr with the Milwaukee Journal-Sentinel has several questions. I'll ask them one at a time. So the first one is for Dr. Weston. With the Kosciuszko Community Center closing this week, will the county continue other vaccination efforts, including in-home vaccinations?
So absolutely. So this is part of our transition from larger scale sites to more focused efforts. And part of those focused efforts, among others, are certainly in-home vaccinations.
Thank you, Dr. Weston. The next two, I think, are for the mayor. The first one is, what would you say to residents and or business owners who see the lifting of Milwaukee's health orders and mask requirement on Tuesday as a return to normal?
Well, it is certainly a step toward a return to normal. But if I had a drum here, I would be beating the drum over and over and over again that it's also a pivot. And the pivot is to the major emphasis right now going forward will continue to be vaccinations. And so we're going to continue to do everything we can over the next few months to get more and more people vaccinated. But I recognize everybody wants to get life back to normal. We all do. We're clamoring for the normalcy. But we are closer, but we're not there. And the faster we can get people vaccinated, the safer they'll be, the safer their family members will be, and the safer our community will be.
Allison's next question for the mayor is, how was June 21st chosen as the day to reopen City Hall and other city buildings? And what specific services will be more accessible to residents on that date?
As is everything in life, it was a balancing act. We had made the decision initially, as you may recall, to lift the order June 15th, which I believe is a Tuesday. And so in our conversations with our Department of Employee Relations in the Health Department, we thought that it made sense 6 days after that, the Monday after that June 15th, that we would ask people to return to work. It was only hours later when we got the bombshell announcement from CDC that masks weren't necessary. And it was following that we moved that timetable up to June 1st. Having said that, we also were concerned with the impact this would have on our employees, many of whom probably needed some time to pivot. And so we thought, well, let's stick with the original date of June 21st, which is a Monday. And that will give people who have childcare issues or elderly care issues time to make arrangements, because we want to be a responsible employer as well as be open to the public. So those were the driving forces. And I think it's nice that it coincides with the beginning of summer, June 21st.
Nick Bohr with WISN 12 has a question for Director Rausch and Dr. Weston. Can you talk about the census tract in Whitefish Bay that shows it's 100% vaccination? Is that possible? And regardless, have you looked at why it might be so high in some areas versus others?
So this answer gets into a little bit of detail, but you asked. So there's 3 census tracts. I think there's 3 census tracts in Whitefish Bay. One of them, the one we're I think talking about, is 702. This is the census tract right along the lake. It's the second highest vaccinated census tract in all of the county. And it's at about 75% vaccinated for first doses. Now, on our Milwaukee County dashboard, we previously had, and this is where we get a little detailed, we previously had the denominator, so the number that we divide by, being 16 and older. Now, when vaccine opened up to 12 to 15-year-olds, that opened up a possibility of the numerator, the top number, being higher than the bottom number. And that did happen by one person last week. So when you included the 12 to 15-year-olds, it was higher. So to summarize all this, we modified the numbers on the dashboard. So the denominator now, we look at all population, because that's really what we're working toward when we think of herd immunity or when we think of vaccination numbers, is we're working toward vaccinating as many people across the spectrum of the population as possible. And by those numbers, they're still number 2 in the county for census tracts vaccinated, but they're at about 75% vaccinated for their entire population. And then the second part of your question, why so high in some areas compared to others? Certainly a lot of that plays into vulnerability and the barriers that vulnerable populations face, whether those are transportation barriers, information barriers, childcare barriers, job barriers, whatever it is. There's a lot of barriers in those communities. And when we look at the EVE model on our dashboard, we compare vulnerability to vaccination, and we see certainly we've made a lot of improvements over the last, I think it's been nearly 8 weeks since we launched that model. But in the beginning, we really had 2 populations. We had low vulnerability and high vaccine, and we had high vulnerability and low vaccine. And the group that we've been focusing most on is, of course, that one with high vulnerability and low vaccine. And we've made a lot of headway there.
And perhaps you can address Nick's second question, which is, it's been suggested that reporting of new cases should include how many of these individuals were unvaccinated. Do you think that would be helpful or motivating?
It's an interesting question. I think that what we know from looking at the science of the vaccine and the effectiveness of the vaccine is that far and away, most likely, and when it's been looked at, the vast majority of people who get infected with COVID are unvaccinated. There are some breakthrough infections in vaccinated people. They tend to be very mild cases, and they tend to be pretty few and far between. So presumably the vast majority of cases that we're seeing are vaccinated. Now, I think it was the last briefing about a study out of Ohio, the state of Ohio, that showed that 99.75% of people who are hospitalized since January were not fully vaccinated or were unvaccinated. And I think that's telling to the power of the vaccine and the effectiveness of the vaccine in really protecting those individuals. We talk about the community level protection, but this talks about the protection to that individual who gets vaccinated.
The next question is for Dr. Weston from Joyce Garbasiak with WISN 12. She says, President Biden has stated a goal of at least 70% of American adults having had at least one dose by July 4th. As of now, Wisconsin is at 47%. How realistic is it that we will reach 70% by July 4th?
Well, I think it's going to be a challenge, but I think we've done a lot of things to shift our strategy on vaccination to reach more and more people. I hope that's part of the reason we've seen a doubling in the number of our vaccinations per day over the last week. I'm hopeful that we can continue to push up our numbers and get closer and closer to that number, and really, in the end, get more and more people vaccinated. 70% is an outstanding goal, but the real goal is just to get as many people vaccinated as we possibly can.
Our next message is from Madeline Anderson with Fox 6. Perhaps, Mayor, you can jump in first. What is your message to people who are refusing to get the vaccine and see little reason to get it in the future if mask requirements and other restrictions are going away anyway? Many unvaccinated people plan to not wear masks, even though the CDC recommends they do so.
Well, the fact that the mask requirements are going away should be an even louder call to individuals who are not vaccinated to get vaccinated. Because the fact that you don't know now whether you are interacting with someone who is infected or not. Previously, if people were all wearing masks, you were safeguarded more. So it really, I think, puts a premium on individuals to get that vaccination to protect themselves. So that would be my major argument, is you don't know that the person you're talking to is vaccinated or not. And if you don't want to get sick, get the shot. So to me, again, it puts more of a premium than we've ever had before on getting the vaccinations. That's the most important message I can give. And I recognize that there are people who don't like vaccines or people who don't like masks. But I also think it's important to recognize the progress we've made. And Dr. Weston knows these numbers far better than I do, and Darren Roche does. But I thought I saw an article that said that for the normal flu vaccination, it might be in the neighborhood of 30 to 40%, maybe that gets vaccinated in a flu season. So we are trying to do something pretty extraordinary, and that is to convince a large group of people who normally would not get the annual flu shot to get this shot. So nobody said this was going to be easy, but I think as long as we have a positive message, that message is based in fact and science and public health. I believe that people want to do the right thing ultimately. And if we can take the politics out of it and just persuade people that this is the right thing to do for them and their family and their community, I think we're more likely to do it. Again, my final statement is in the 1950s with the polio shots and the polio vaccine, you had people standing in line because there was this commonality. There was this almost patriotic response to making sure that people were guarding themselves. I'd like us to see us get there. I still think we can, as long as we say positive and truthful in what we're telling people.
Yeah, I would completely agree with all that. I think that in my mind, there's two reasons to get vaccinated. One, and the reason that sometimes is a little harder, I think, to wrap your head around is to protect your community. And I think the most tangible way to see that is one, the disease burden that's going down as more people get vaccinated. And two, just thinking, even if you are young and healthy, think of who is around you. Think of your parents, your grandparents, your coworkers, your neighbors. You don't want to pass the virus to them either. We've talked about that for 16 months now. But I think the other main reason, protect your community, is one. I think the other one is to protect yourself. And one part of that is to protect yourself from the acute effects of COVID, the illness, the flu-like illness, potentially the hospitalization, and so on. But it's also the long-term effects, and we're learning more and more about that. So even if you're young and you're healthy, there are the long-term effects to consider. The fact that about 1 in 5 young people, 18 to 34, who are healthy, has some sort of long-term effect from COVID. So there's a lot of reasons to get protected. And there's a lot of reasons to get the vaccine.
Our final question is for Mayor Barrett, and it's from Mike Spalding with WTMJ. He asks, with vaccination numbers where they are and the city ready to lift its mask mandate next week, can you talk for a minute about the closure of the Wisconsin Center as a vaccination clinic, and were you happy with how it was used during the past few months?
I was very happy with how it was used during the past few months, and it has done exactly what we intended it to do. Nearly 140,000 people have received vaccines there. That's a tremendous success. And so it played its role. We all have roles to play in this drama, and the Wisconsin Center played its role extremely well. And now it's time to move on to the community aspect of it. So I'm thankful, as I said in my remarks, I'm thankful to our health department, to our FEMA partners, to everybody who was involved. They did a tremendous job.
It appears we have one more question from Joyce Garbasiak with WISN 12. They are receiving calls from people who are upset that they're not eligible for free Brewers tickets or Summerfest tickets because they were responsible and got their vaccine at the first opportunity. What do you say to people who contend they should be rewarded because they got vaccinated?
Congratulations, you got vaccinated. You did the right thing.
All right. Well, that is a good one to end on. Those are all the questions I'm seeing in the chat. Thank you all for being here. Have a safe holiday weekend, and we'll see you next Tuesday. Take care.
Thank you.